Да, приношу свои извинения, произошел разрыв связи. Надеюсь, что хорошо слышно. Светлана, вы меня слышите?
Yes, we can hear.
И я хотел бы, завершая свое выступление, что за 10 лет при поддержке лидерства ВОС были согласованы глобальные цели, система мониторинга их достижений, глобальный план по борьбе с неинфекционными заболеваниями, а также отмечен прогресс по данному направлению на страновом уровне. Отрадно в эту годовщину отметить и создание целевого фонда по неинфекционным заболеваниям и психическому здоровью, который призван оказать поддержку множеству стран. В завершение позвольте выразить благодарность делегациям стран, агентствам Организации Объединенных Наций и негосударственным участникам. Мы призываем всех поддержать борьбу с неинфекционными заболеваниями и присоединиться к друзьям целевой группы. Благодарю вас за внимание.
Thank you very much, Honorable Minister Mikhail Albertovich Murashko. We have some technical problems, and I apologize to colleagues who are lost at us for the moment, and also Your Excellency Mikhail Albertovich. It's some worse technical problems that we lost you for the moment. Thank you very much for continuous support of the Russian Federation on the Ncd agenda. And let us continue our meeting today. And it's a great pleasure for me to give the floor for the Director General of the WHO, Dr. Tedros. Over to you. I hope we will not have any problems technical.
Thank you. Thank you, Svetlana. Your Excellency Mikhail Murashko, Minister of Health of the Russian Federation, Excellencies, honorable ministers, dear colleagues and friends. Let me begin by thanking the Russian Federation for its leadership on non-communicable diseases and mental health, and particularly your support of the Interagency Task Force on NCDs. Thank you also to Bahrain, Norway, Philippines, the European Commission, the Gulf Health Council, UNDP, and UNODC for co-sponsoring this meeting. COVID-19 is a wake-up call for the global health and development community, particularly when it comes to NCDs and mental health. We know that people living with NCDs and mental health conditions are more susceptible to COVID-19 and at greater risk of severe disease. The COVID-19 pandemic has badly disrupted the delivery of NCD services for diagnosis, treatment, rehabilitation, and palliative care. Over 75% of countries have reported interruptions in care due to the pandemic, affecting millions of people. It's clear that COVID-19 is going to make it even more challenging to meet the NCD-related targets of the Sustainable Development Goals, especially in low and middle-income countries. At the same time, the pandemic provides an opportunity to innovate and rethink and to step up our game. The task force members have demonstrated that work on NCDs and mental health can continue online. This includes conducting a range of joint programming and investment case missions and follow-up actions to countries. A special thanks to the Russian Federation, the Gulf Health Council, the European Union, and the government of Italy for their generous support. These efforts allow the task force to carry out its work. I would like to highlight the Access Initiative to Quit Tobacco, which assists countries in providing comprehensive smoking cessation services. The supporters of this initiative include private sector partners such as Seoul Machines, Johnson & Johnson, and Cipla. Scaling up action against NCDs is not possible without adequate funds. While countries must increase their domestic financing for the prevention and control of NCDs and improving mental health, catalytic support from the international community is also crucial. I'm therefore delighted that WHO, UNICEF, and the United Nations Development Programme have established the Multi-Partner Trust Fund to support action on NCDs and mental health and we will be hearing from both agencies later today. The trust fund will be country-led, with a focus on equity and impact in our collective drive towards universal health coverage. I call on all development partners to support the trust fund, a critical initiative whose time has come. Together, we're committed to drive cross-sectoral action that by 2030 is designed to lead to 8 million lives saved, 80 million healthy life years gained, $350 billion of economic benefits for low and middle income countries, and countries to building back better in their response to COVID-19. We have come a long way since heads of state and government adopted the first political declaration on the prevention and control of NCDs a decade ago. There have been many successes since then, but much work remains if we're to meet the SDG targets. There is no time to waste. I would like to leave you with 3 priorities. First, continue to support the task force in its crucial work. Second, direct resources to the trust fund, which is certainly a health sector best buy. Third, to my colleagues across the UN system, we must all coordinate more closely and redouble our efforts to mitigate the growing burden of NCDs and mental health conditions. I thank you. Spasiba большое, Mikhail. Thank you.
Thank you very much, Dr. Tedros. Thank you for this very impressive speech. Let us move to the next agenda item that we have for today's meeting, and we will get a quick update of the activities that we have under the UN Interagency Task Force. And this presentation will be prepared by my colleague from the Global NCD Platform Department, Dr. Alexey Kulikov. Before we will go this, I want to say that we have the interpretation for all 6 languages, and also you can send us questions into the chat box and we will respond it later. So over to you, Alexey. Please take the floor. Thanks.
Thank you, Svetlana. Excellencies, honorable ministers, distinguished colleagues, friends, good morning, good afternoon, and good evening. NCDs is about health and wealth. UN Task Force is committed to support member states on its road to the SDGs in their quest for healthier people and more prosperous future. The 2021 Ecosoc Resolution was ambitious. It called upon the task force to support member states in their national COVID-19 response and recovery efforts, implementing the WHO FCTC, strengthening regulatory and legal frameworks, strengthening health systems responses, including those in vulnerable situations. And the resolution encourages bilateral and multilateral donors and relevant stakeholders to support member states through recently established UN Multi-Partner Trust Fund to catalyze actions on NCDs and mental health. The side event is about mobilizing resources and technical support. So let me start with the new UN Multi-Partner Trust Fund established by WHO, UNDP, and UNICEF. It is a country-led fund which aims to catalyze action in countries on mental health and NCDs. Current official development assistance, ODA, for NCDs is woefully small. Less than 2% of ODA is for NCDs. The impact of this underinvestment became clear during the pandemic, impacting those living with NCDs and mental health conditions the most. We estimate that a $250 million fund will by 2030 catalyze action to save 8 million lives, avert $350 billion in economic losses. Impressive returns. The governance and strategic direction for the trust fund will include representative countries from the Global South who are joining as founding strategic partners. These partners are making a commitment to champion this trust fund, to help ensure that it will be fully capitalized and oversee that it is keeping to its mission and its objectives. We call on member states, large and small, as well as foundations, civil society organizations, private sector, to contribute funding, knowledge, and technical resources to ensure this fund is a success. On the technical assistance front, agencies are now using the briefs on how to respond to NCDs that were launched at last year's Friends meeting. They have been critical instruments in supporting governments scale up action during the pandemic. We are encouraging other task force members to develop similar briefs to steer their action. Last year, Friends meeting saw the launch of a suite of task force papers on NCDs and COVID-19 led by WHO and Undp. They included a blueprint for global action as well as a strategic actions for 30 members of the task force. This year, agencies have updated their strategic efforts, but importantly have included examples of recent activities. This allows a demonstration of how strategy is being turned into action. You see the return from UNRWA, the UN Relief and Works Agency. Existing joint programs and partnerships led by task force members continue to be strengthened to support countries in their response to the pandemic. For example, the Access Initiative to Quit Tobacco, IQUIT, which works with governments, UN agencies, private sector, has mobilized on more than $5 million to scale up tobacco cessation in low and middle income countries as part of their COVID-19 responses. Like everyone else, much of the task force's work has had to be conducted virtually, but that hasn't stopped work at country level. Thanks to funding from the Russian Federation, the EU, the Gulf Health Council, the government of Italy, we continue to be able to scale up support to countries. More countries continue to receive NCD investment case missions, but significantly this year has really seen us move forward in supporting countries undertake mental health investment cases. We are grateful to the Russian Federation for support to follow up investment cases through developing tools that help countries benefit from implementing health taxes. New approaches for area-specific joint programming missions are being developed. For example, harmful use of alcohol, tobacco cessation, air pollution, NCD clinical interventions. Investment cases are catalyzing action in countries, for example, improving strategy, collaboration, and coordination, as well as fiscal and other measures for effective NCD responses. Here are some examples of policy changes following investment cases. More examples along with relevant reports are available on the task force web pages. Thanks to funds from the EU, we are starting to scale up whole of UN responses for longer-term in-country funding in a small number of countries that have received task force missions in the past. Areas of action are those where the UN system as a whole can make the biggest impact. Earlier this year, we published 2 briefing papers that we find are helping in advocating for ever greater action from the UN system. The first is how governments can encourage United Nations country teams to scale up support for NCDs and how governments and UNCTs can work together to agree joint action. The second builds on our experience of a joint TB and NCD mission to Nigeria last year. It describes how countries and their partners can use the task force as a platform to strengthen responses to NCD-related SDGs and broader public health goals. The task force is committed to evaluating the response of the UN system to the NCDs and mental health. Here are 3 examples. The first is an assessment of the impact of the UN thematic working group on NCDs at the country level, in this case, Thailand, a group that was established after a 2018 mission to the country. The second is evaluation of the UN joint program on cervical cancer. The evaluation is providing a pivotal tool in ensuring the UN as a whole can play an effective part in WHO-led global cervical cancer elimination initiative. The third is evaluation of the task force as a whole, which formed part of the midpoint evaluation of the WHO Global NCD Action Plan. That final evaluation will be critical in helping task force to develop a successor to its 2019-2021 strategy and what the strategic priorities for 2022 and beyond should look like. Please let us know your thoughts on what should be our future strategic priorities. Here is a reminder of the current ones. Thank you for your attention. Please be assured that these slides will be made available on the task force web pages. And back to you, Svetlana.
Thank you, Alexei. Thank you very much for providing us the update and the activities that we have of the task force in the regions. And now it's my pleasure to introduce Chantal Bousson, who will give us a testimony on her own experience living with NCDs and mental health. Over to you, Chantal. Please take the floor.
Thank you, Dr. Axelrod, and thank you to Director General Dr. Tedros and Honorable Minister of Health, Dr. Murashko, and good day to our distinguished guests, our delegates and friends. I'm connecting to you from Durban in South Africa. I want to acknowledge and welcome the progress that's made by including civil society voices in the opening address in this meeting. It's not only fitting, but it's also critical to hear from those who are most affected by decisions made and displayed in this forum. That being said, I'm not the ideal representation of all civil society or people living with NCDs in the world. I am, however, a representation of my own expertise and my experiences living with mental illness and growing up with family members struggling with depression, bipolar mood disorder, schizophrenia, and most fatally, suicide. I also grew up with family members who lived with and died from cancer, diabetes, and heart disease. All of these NCDs so prevalent in our lives. My experiences are not unique, and people the world over are affected by and dying from preventable diseases. The reasons for the devastating impact of preventable diseases is deeply complex, as you will know, and it's rooted in the socioeconomic, political, and cultural influences of countries all the way across to hyperlocal communities. From my perspective, there are two overarching components to why we are experiencing the perpetual devastation and impact of non-communicable diseases. And those are, one, the lack of empathy, and two, the lack of trust. There's an inherent lack of empathy in the development of systems, of laws and policies by those responsible for running countries, provinces, districts, and communities. And that, coupled with a lack of capacity for empathy from civil society, especially as individuals, groups, and communities work so hard to build and rebuild where leadership does not support them in a meaningful way. Recently in my country, we had a very visceral experience with the attitudes of medical and political experts towards civil society and people living with NCDs. An interministerial advisory committee was established to advise the South African government on a rollout process of the COVID-19 vaccines and related issues. When asked by a journalist why there are no representatives from NCD groups who are directly and disproportionately affected by the disease, an academic on this committee stated, and I quote, "The Ministerial Advisory Committee is a body of scientific and medical experts who look at scientific aspects and not the sociological and anthropological and any of those kind of issues. It's not really appropriate for them to be on this committee." Now, this for me was very telling, and it's rather brazen, to be honest, when we are facing the high rates of vaccine hesitancy in so many countries right now, and communities right now. When we talk about the lack of trust, it's the lack of trust of leadership when there is little to no meaningful involvement of those groups who are most affected by these critical decisions. And to be honest, it's exhausting being an activist right now, especially when you see how leadership actively undoes civil society's hard work being done on the ground. People are anxious and they are depressed. They're anxious and depressed about their past, their present, and their futures. They're anxious and depressed about misappropriation of funds, bad decisions, and self-serving politics. By prioritizing empathy and trust building when mobilizing technical and financial resources through active and meaningful participation of groups and individuals living with NCDs, as well as their carers, we will see the efforts discussed and presented today accelerate to that of real large-scale impact. Empathy is social justice, and trust will help us get there. Thank you.
Thank you very much, Chantal. It's really a great pleasure that you find time to join us and to give these very impressive inputs and your speech and interventions. And from our end, I could say that WHO is working very closely with the civil society. We have the civil society working group, which was established by the Director General, and we are continuing working on this area. And involving people living with NCDs and mental health is very important to the work of the organization. Let us continue our meeting today, and we have now the keynote speakers. It's a great pleasure that we have today with us the Vice President of Zimbabwe, Minister of Health and Child Care, Dr. Konstantin Chivenga. He provided us a video message. Unfortunately, he couldn't join us on live, but the video will be shown shortly. I hope there will be no technical problems. Thanks. Over to the Vice
Director of
President.
Ceremonies, Minister of Health of the Russian Federation, Honorable Dr. Mikhail Murashko, World Health Organization Director General, Dr. Tedros Ghebreyesus, distinguished speakers here present, ladies and gentlemen. I am honored to address the United Nations General Assembly on behalf of the government of Zimbabwe in my capacity as Minister of Health and Child Care. Allow me to recognize the immense contributions made by the United Nations Interagency Task Force on Non-Communicable Diseases, NCDs, led by the World Health Organization, WHO. The United Nations Interagency Task Force aims to bring together all United Nations agencies, programs, and funds in supporting countries to achieve the NCD's Sustainable Development Goals, SDGs. This will assist countries in the development and implementation of multi-sectoral health policies to strengthen national response. In this regard, the Minister of Health and Child Care is working with World Health Organization and other ministry partners to develop a national NCD strategy that is aligned to the country's National Health Strategy 2021 to 2025 and to the National Development Strategy 1. Zimbabwe is also working with the International Atomic Energy Agency and World Health Organization to develop a national cancer control plan. The government of Zimbabwe makes a commitment to address the prevention and control of NCDs and will strive to mobilize resources and technical support to meet SDG target 3.4. As a country, we acknowledge the convening of the first global ministerial conference on healthy lifestyles and NCD control held in Moscow from 28 to 29 April 2011. The conference was successfully organized by the Russian Federation and the World Health Organization. We also acknowledge the adoption of the Moscow Declaration and the recall Resolution 64.11 of the World Health Assembly, which speaks to the control of NCDs. According to the World Health Organization, NCDs now account for around 42% of the disease burden in the country. non-communicable diseases share common risk factors and can benefit from a common national response that the country is geared to produce. The dominance, morbidity, and mortality of NCDs in Zimbabwe can be greatly prevented and controlled through collective and multi-sectoral action by health and non-health sectors in the country by mobilizing and distributing resources to national and sub-national levels. The prevention of NCDs must be the cornerstone of national and regional response. Communicable diseases like HIV and TB are currently the most common causes of death in Zimbabwe. NCDs are projected to become the most common causes of death by 2030, giving the country a double burden of disease. In today's globalized world, rapid urbanization, mechanization of the rural economy, and the activities of transnational food, drink, and abuse of dangerous drugs are associated with increased risk of NCDs. Zimbabwe is also rolling out the World Health Organization package of essential non-communicable pen diseases at the primary care level. The success of the pen strategy depends on, one, improving the availability of essential medicines at the primary care level, such as for diabetes, hypertension, and mental health. Two, integration of NCD services at the primary care level with existing services such as HIV, TB, malaria. And lastly, three, task shifting policy that will allow nurses at the primary care level to screen, identify, prescribe, and manage cases of NCDs. The mental health strategic plan was launched in 2019. This year in July, I was the guest of honor at the launch of the World Health Organization Special Mental Health Initiative for Zimbabwe, which addresses the Zimbabwe government's vision of increasing access to mental health. It is a tool that will leverage increased resources to mental health services while ensuring that the resources are efficiently allocated. Zimbabwe recognizes the contribution of traditional and local knowledge in the fight against the NCDs. In this regard, the country respects the knowledge and use of traditional medicines. The COVID-19 pandemic has disrupted critical NCD services in the country. In 2020, the Ministry of Health and Child Care conducted a rapid assessment survey of the impact of the COVID-19 pandemic on essential health services. The survey established that people living with hypertension and/or diabetes were more likely to die from COVID-19 than those not suffering from these conditions. I wish to conclude by underlining that Zimbabwe is committed to ensuring the availability of essential health services during and after the COVID-19 pandemic. I thank you.
Thank you, Vice President of Zimbabwe, for this video message that you sent it to us. It was very important for us. Also, as I said, that we have today the representatives of the UN agencies with whom we are working very closely in the UN Interagency Task Force. And it's a great pleasure to give me the floor to the UN Under Secretary General and Associate Administrator of UNDP, Usha Rao Molnari. Over to you. We can't hear you, you are muted.
Thank you very much, Dr. Axelrod, for the opportunity to participate in this excellent panel. Minister Murashko, Dr. Tedros, Excellencies, distinguished delegates and guests. UNDP is honored to join the UN Task Force on NCDs and its valued friends at this annual event. COVID-19 pandemic continues to affect countries differently and pose new challenges almost daily. And I noted with interest and some alarm the intervention of Chantal on her experience. Almost 1/4 of the global population has an underlying condition which increases vulnerability to COVID-19. Most of these conditions are NCDs. This perfect storm, if you will, created by the convergence of COVID-19, NCDs, and inequalities, has overwhelmed even the strongest health systems and amplified the pandemic's socioeconomic impacts, particularly in vulnerable communities. COVID-19 vaccine inequity is adding fuel to the fire, I'm afraid. Many of the poorer countries left behind in COVID-19 vaccination also face large NCD burdens. The pandemic has also worsened mental health across the globe. In fact, prevalence of depression, anxiety, and insomnia, which are also symptoms of long COVID, have all soared above 30% during the first year of the pandemic. Yet, just when critical mental health services are needed more than ever, 93% of countries worldwide have reported pandemic-related disruptions, and that is truly alarming. Essential services for NCDs, such as cancer screening, have also been upended. Scaled-up action on NCDs and mental health is critical to the COVID-19 response and recovery, to achieving the SDGs and leaving no one behind. More investment is needed in NCDs and mental health, without doubt. A recent report by the US Council on Foreign Relations found that funding for NCDs declined to just 1.6% in 2020, less than 2% as a share of foreign aid for health. That is 1.6% to address over 60% of the world's total burden of the disease. And that is, in fact, an important statistic. UNDP and our sister UN agencies have been jointly supporting member states through the work of the task force. This has grown more urgent in the context of COVID-19. We are proud to have partnered with WHO and UNICEF to establish the multi-partner trust fund for NCDs and mental health. This fund can be an important opportunity to strengthen UN system support to countries. And it can build on existing joint programs under the task force, which have already proven to be catalytic in spurring whole of government action. UNDP works with partners such as WHO, the Secretariat of the Framework Convention on Tobacco Control, and others in 65 countries on NCDs, tobacco control, and mental health. Through this work, we're supporting countries to save lives and advance sustainable development. UNDP's new strategic plan, 2022 to 25, commits us to do still more together with UNICEF, WHO, and other partners on NCDs and mental health. Enhancing our joint work on this important topic is critical to expanding people's choices for a fairer, sustainable future and to getting the SDGs back on track. I thank you.
Thank you very much, Usha, and it is very great pleasure that we have a long history of collaboration with the WHO and UNDP, with the funds that we get from the Russian Federation. And it's my honor and pleasure to invite the Executive Director of UNICEF, our partner of the Trust Fund, Henriette Fora, to provide her video statement during our keynote speakers.
These are difficult times for the world's children and young people. Socioeconomic consequences of the COVID-19 pandemic are compounding pre-existing crises including climate change, conflict, and barriers to learning and earning opportunities. The pandemic has also exacerbated global crises in children's mental health and non-communicable diseases. Even before the pandemic, children and young people carried the burden of mental health risks, with half of all mental disorders developing before age 15 and 75% by early adulthood. The majority of the 800,000 people who die by suicide every year are young people, and self-harm is the fourth leading cause of death among 15 to 19-year-olds, with higher rates among adolescent girls. It is estimated that globally 1 in 4 children live with a parent who has a mental disorder. A growing number of children and adolescents across the world are suffering from undiagnosed and untreated mental health conditions. They are also increasingly exposed to risk factors that increase their susceptibility to chronic diseases and dying from preventable illnesses. Conditions such as diabetes and cardiovascular disease often manifest in adulthood, but the seeds are planted early in life. Childhood risk factors for mental health conditions and non-communicable diseases include unhealthy diets, physical inactivity, consumption of tobacco and alcohol, breathing polluted air, and limited access to essential services and support. And that is why it is critical to significantly increase investment in primary health care and quality health services from infancy into adulthood. Ensuring access to quality care in childhood will help to prevent future illness and secure positive health outcomes. Over 1/4 of the world's population is under the age of 15. Children and young people are the future, and their health should matter to all of us. New pandemics will test humanity. We need to be prepared, and an important part of that preparation should be to strengthen health systems and prevention measures against mental health conditions and non-communicable diseases. And that is why UNICEF, WHO, and UNDP, as part of the One UN family, are now core partners in the United Nations Multi-Partner Trust Fund to catalyze action for non-communicable diseases and mental health. UNICEF brings 75 years of experience in advocating and programming for children, along with our presence in almost every country across the globe. Building on our work in prevention of non-communicable diseases in childhood and our programming for mental health and psychosocial support, we will work within this multi-partner trust fund to ensure that no child is left unseen and that the elimination of threats to children's health is given top priority. Today, we join WHO and UNDP on this auspicious occasion to issue a call to everyone, everywhere, to join this fight for a better tomorrow for children and young people.
So that was the video intervention from the Executive Director of UNICEF, one of our partners, as it was mentioned by the Henrietta Fora. We are one UN family. And today we also have a great pleasure to invite the keynote speaker, Dr. Carla Barnett, the Secretary General, Caribbean Community Secretariat, to join us in live, and I hope you are connected. Please take the floor.
Thank you very much. I am very much alive and here and present listening to this very interesting conversation that we're having on a very important topic. Vice President of Zimbabwe and Minister of Health of the Russian Federation, Dr. Tedros of the World Health Organization, high-level representatives of governments, members of the diplomatic corps, distinguished speakers, ladies and gentlemen, good morning. I would like to thank the organizers and sponsors of this event, the Russian Federation and the World Health Organization, for the invitation to address this distinguished gathering. Today's event, hosted under the theme, mobilizing resources and technical support with and for member states to deliver the NCD and mental health related sustainable development goal targets during and beyond COVID-19 is indeed very timely. The COVID-19 pandemic has underlined the risks posed by non-communicable diseases and has exacerbated the problem of mental health. The pandemic has reminded us that we have many commonalities in spite of differences in size and resources. We experience the impact at the varying levels, but what will get us through is multilateral cooperation and actions to address the range of challenges that we are experiencing. Chair, it was in CARICOM that the issue of the silent epidemic of NCDs was first brought to the focused attention of a group of heads of state and government. The 2007 Port of Spain Declaration on NCDs, emanating from an historic summit of CARICOM heads of government, resulted in commitments from our member states to support multi-sectoral action for NCD prevention as a part of the broader development agenda. This therefore helped to pave the way for our support to the Moscow Declaration on NCDs of 2011 and the UN Political Declaration on NCDs of 2011. Indeed, this year marks the 10th anniversary of this landmark document that attracted the world's attention to the major problem posed by NCDs, including obesity, diabetes, and cardiovascular diseases. Notwithstanding our attempts to implement the commitments of the NCD declarations, the Americas still records the highest burden of NCDs, with 79% of all premature deaths being NCD related. In addition, mental, neurological, and substance abuse disorders are among the leading causes of the burden of the diseases and are responsible for 19% of the overall loss in disability-adjusted life years in the region. CARICOM member states are particularly susceptible to NCDs, as we suffer from vulnerable food systems, obesity-related food environments, trade barriers, and increasing food importation costs. In a tangible show of support to our regional efforts, the UN Interagency Task Force on NCDs launched investments in a number of Caribbean territories to advance policies to prevent and control NCDs. This was successfully executed as the work of the task force was very instrumental in advancing policies to address tax increases on sugar-sweetened beverages. In November 2019, the CARICOM Ministerial Councils for Trade and Economic Development and Human and Social Development agreed that 2 intergovernmental working groups would be established in the battle against NCDs. One focused on unhealthy diets and obesogenic environments, and the other on the harmful use of alcohol for advancing regional policies, programs, and actions for NCD control. Under the umbrella of these committees, technical experts from across the region, led by the Caribbean Public Health Agency, are brought together with counterparts from Public Health England, Public Health Canada, the Pan American Health Organization, civil society, and the private sector to review best practices and to support advocacy for the requisite national policy changes. These would address such issues as the elimination of trans fats in prepackaged foods, the reduction in obesity-related school environments, and the generation of revenue from increased taxes on harmful substances, such as alcohol and tobacco. Front-of-label packaging is one of the main areas that's being examined at this time. The process for the revision of the CARICOM regional standard for the labeling of pre-packaged foods to include front-of-package criteria has begun. The front-of-package labeling system is designed to make the healthy food choice the easy choice through a simplification of warning signs when foods are high in salts, sugars, or fats. A regional technical committee of experts was established to draft revised labeling standards. Every member state was encouraged to establish a national mirror committee to develop national standards under the guidance of their respective Bureau of Standards. In February of 2021, earlier this year, a final draft CARICOM regional standard on the labeling system was circulated to member states for national consultation and approval, and we expect a final determination and announcement when the Ministerial Council on Health and Social Development meets later this month. Chair, the COVID-19 pandemic has placed an unprecedented burden on the limited human and financial resources in our community. Indeed, the International Monetary Fund has identified our region as the most adversely affected economically in the world. Many of our member states are heavily dependent on the tourism industry, and the results of protracted closed borders and lockdowns on the fragile economies are catastrophic. Even though we had been doing commendably well as a region in our initial public health responses to the pandemic, with the rise of the Delta variant, we are seeing an exponential rise in the number of cases, placing untold pressure on our health systems in general and human and financial resources in particular. Every member state has had to divert monies from other critical sectors to bolster the crisis response. In many member states, the pressure on social services to support the growing and persistent needs of the population is unsustainable. The COVID-19 pandemic has also placed additional mental health stressors on families as they deal with lockdowns and loss of income. There have been increased instances of domestic and family violence, which has been linked to the deterioration in the mental health of those affected by the social and economic fallout from the pandemic. At the other extremes, persons who live alone have reported feeling isolated and emotionally depressed over long periods of lockdown and inability to socialize. This has also been the experience of school children, as they have not been able to attend face-to-face classes and mingle with their friends. Getting medical services to such persons has also been a challenge. Many of our member states now have hotlines which persons are encouraged to call in case of a mental health related crisis. Based on the lessons from the COVID-19 pandemic, there is urgent need for transformative action. CARICOM recognizes the need to regain momentum in our fight against the NCDs and to engage frontally with the mental health challenge. We therefore welcome the establishment of the UN Multi-Partner Trust Fund for NCDs and mental health, as this will significantly address the resource mobilization deficit we are experiencing and bolster cross-sectoral and whole-of-society solutions. This proposed investment will augur well for our citizens and contribute to the achievement of our NCT targets and sustainable development goals. We are pleased to note that this partnership includes UNICEF, UNDP, and WHO, who we look forward to working with at the national level with national governments, non-state actors, and other development partners to pursue a shared agenda to promote mental health and prevent NCDs in our region. To regain lost ground in our NCD efforts and to address the mental health concerns, policy coherence, and pooling of resources across sectors and disciplines are essential. We welcome this One UN approach with a strong emphasis on whole of society solutions. CARICOM is home to just 16 million citizens, but 60% are under the age of 30. In this context, it is essential that our member states are supported to develop policies and programs that incorporate the specific needs of youth, working across education, development, and health sectors. I look forward to a strong involvement from CARICOM countries to ensure that this fund will address their distinct concerns. On behalf of the Caribbean community, I express sincere appreciation for the task force and its proactive steps in spearheading this effort. Thank you for standing together with us in solidarity for health. I am quite confident that as a united front, we can turn the NCD epidemic around and improve access to solutions to address the mental health challenges. Thank you very much for the opportunity.
Thank you very much, Dr. Barnett. It's a great pleasure that you joined us. And of course, we understand the difference of time. So it's very good that you're with us today. So let us move to the next agenda item of our meeting, and it will be the half-an-hour panel discussion, which will be moderated by my colleague, Dr. Nick Banatwala. Let me ask Nick to take the floor and to moderate the discussion about the resource mobilization, technical support with and for the member states to deliver the NCD and mental health related agenda on Sustainable Development Goal targets. So over to you, Nick, to moderate the discussion.
Thanks very much, Svetlana, and greetings, Excellency and colleagues. I know we're running a bit behind, but it just is testament to the importance of the subject underway today. We do, I understand, have this room and the interpreters in for another 3/4 of an hour, so we can run over. So please do push back your next engagements if you can at all possible. Let's go straight on to our first speaker, Francesco Duque, who's the Secretary of Health in the Philippines. It's now late into the night there, so he is going to provide his intervention by video recording.
The government of the Philippines, through the Department of Health, is committed to tackling non-communicable diseases and mental health conditions. And our steadfast commitment has been demonstrated through significant efforts embedding this into the architecture of universal healthcare implementation in the Philippines, including various tobacco control policies, tobacco and alcohol taxation, guidelines for labeling pre-packaged food, along with the multi-sectoral strategic action plan for NCD prevention and control 2017 to 2025. The Philippine Council for Mental Health, or PCMH, Mental Health Strategic Plan 2019 to 2023, the Plan of Action for Nutrition 2017 to 2022, investing in the prevention and control of NCDs and mental health conditions is an imperative under the objectives of our universal healthcare law. And as we are shifting our focus from treatment to primary care and health promotions programs, in 2019, the DOH, together with the UN Interagency Task Force on NCDs, led by the World Health Organization, launched the NCD investment case in the Philippines, followed by the mental health investment case in 2021. The results of the investment cases on NCDs and mental health for the Philippines have provided evidence-based opportunities to reduce the adverse health, economic, and social consequences of these conditions through preventive and treatment-based interventions. The pandemic has also revealed that quitting smoking is more important than ever. Evidence shows that smokers are more vulnerable than non-smokers in developing severe COVID-19. We are grateful for the partnership with the Access Initiative to Quit Tobacco for supporting access to free nicotine replacement therapy through Johnson & Johnson, combined with personal counseling and digital support to quit smoking. We are equally grateful for the task force continued support in assisting the Philippines. We welcome the Multi-Partner Trust Fund as an avenue to continue to support countries mobilize resources and achieve national goals related to NCDs and mental health. We need to work together in a whole of government, whole of sector approach towards the progressive realization of universal health coverage, providing greater access to treatment and prevention of NCDs and mental health conditions. Once again, thank you very much and mabuhay.
Well, thank you very much indeed for that. Let's move straight on to the General Manager for the Gulf Health Council, His Excellency Suleiman Al-Dakil.
Thank you, Nick, and thank you for the rest of the team. Excellencies, distinguished guests, I would like to express our gratitude for the invitation to join this important event. For more than 40 years, the Gulf Health Council has worked to advance the cooperation among the state of member and the GCC country in the GCC region. Its achievements in all the fields of prevention, curative, and rehabilitation health have been significant. We are committed to serve the GCC countries in prevention and control of NCD and mental health condition. The Gulf Health Council is delighted to have partnered with the United Nations Interagency Task Force and all ministries of health in the GCC countries in coordinating and funding the NCD investment case initiatives for all the member states. This partnership have been impactful and aggressive and progressive for all the GCC countries, and we look forward to for future programs and projects. One of the main outputs of the Gulf Council have been the formation of the integrated GCC health strategies and providing high standard of care for GCC citizens. Along these lines, working with the on the NCD case investment had been informative to all stakeholders, and the result had undoubtedly sharpened our collective strategies to control the NCD in the region. The result of the case investment analysis showed that NCD are more than health issues. They are a sustainable development issue. In the GCC region, NCD cost the economy of our countries about 3% of GDP in lost productivities and health expenditure. This is close to the impact of COVID-19 in 2020 for the economy, according to the IMF projection. Therefore, reducing the burden of the NCD in the GCC region will not only help to save the lives, but also it will help to achieve the strategic vision of our countries. Distinguished guests, over the past years, the GCC countries have been made important steps to prioritize action on NCDs, such as establishing national NCDs committees, implementing nutrition information on food labeling, adopting tobacco control strategies such as plain packaging and excess taxation, and setting specific NCD-related goals in the National Executive Plan for NCDs, among others. We still can do more. We can increase efforts to improve diet and physical activities along with the tobacco control. At the Gulf Health Council, the health promotion and health awareness about NCD and associated behavioral risk factors have been given a priority in all awareness activities. The continuous innovative awareness campaign related to the NCD, which were conducted by Gulf Health Council, have been well received by the public in the region, and they contribute to the control of NCD at the individual level. We look forward together to combat NCD through understanding how to lead healthy lifestyle and to improve the way we work together, the way we plan and coordinate our efforts. We hope by this way we will contribute to the enjoying better health and lead more happy, productive lives for the future generation to come. Thank you very much.
Thank you very much indeed for that. Please keep the chat going so that we can then collate these thoughts and put them together in the summary. Comments we've had so far have been really helpful. Let's go on to our next panelist, my colleague, Dr. Mingui Ren. Welcome to the panel.
Thank you, Nick. It's such great honor and pleasure for me to listen to your intervention on this very important subject. This is absolutely dear to my heart. This month marks 10 years since member states came together in New York to adopt first ever political declaration of high-level meetings of UN General Assembly on the prevention and control of non-communicable diseases. Two subsequent UN high-level meetings in 2014 and 2018 has strengthened the ties between SDG target 3.4 on NCD and mental health and SDG target 3.8 on universal health coverage and primary health care. We have made progress. The risk of dying from the major NCD has declined 1/5 from 23% to 18% since 2000, mainly due to decline in the risk of dying from chronic respiratory disease by 37%, heart disease and stroke by 27%, cancer by 16%. The implementation of WHO Framework Convention on Tobacco Control keeps advancing. Tobacco use is steadily declining. The data shows that countries with policy, legislative, and regulatory measures for the prevention and control of NCD, as well as strong, inclusive health systems, has had best outcomes against NCD. In those countries, people living with affected by NCDs are more likely to have access to effective NCD services, including prevention against NCD risk factors, testing for hypertension and diabetes, and treatment for NCD and follow-up care. The country's adequate funding, genius community engagement, right-based multi-sector approaches, and use of scientific evidence to guide focus strategies have reduced the risk of premature deaths from NCD and saved lives. WHO programs on prevention and control of NCD and promotion of mental health has provided leadership, normative and guidance and country support to most lower and middle income countries over the past decade, and the coordinated work of UN agency through the Secretariat of UN Interagency Task Force and NCD in WHO. WHO's programs on NCD has grown from $300 million in the 2010 to 2011 to more than $500 million in the 2020 to 2021, thanks to support from donors ranging from Denmark, European Commission, Germany, Luxembourg, Norway, Russia Federation, to the foundation, for example, Bloomberg Philanthropies and the Bill Melinda Gates Foundation and the World Diabetes Federation. Being responsible for non-communicable diseases and communicable diseases at WHO, I have witnessed firsthand how WHO guidelines on the use of antiviral drugs for the treating and preventing HIV infections drive change. Therefore, WHO has launched new guidelines last month on the initiation treatment of hypertension in more than 1 billion adults. We anticipate a similar response to the hypertension guidelines as those for HIV. In closing collaboration with NORAD, WHO establishing high-level policy dialogues in Ethiopia, Ghana, India, and Nepal to enhance the capacity, mechanism, and the mandates of ministries of health, finance, and planning in facilitating and ensuring action cross-government sector, civil society, and the private sector to achieve the SDG target on NCD and mental health by 2030. This is a funding in spirit of the World Health Organization. You have entrusted us with resources to translate commitment on paper into real change and impact on the ground. With only 3 years until the 4th high-level meeting of the United Nations General Assembly on the prevention and control of NCD, there's no time to waste. Public and private actors must come together to accelerate progress towards SDG target 3.4 on NCD and mental health. For this, public and private finance for NCD and mental health must increase significantly. We have seen strong efforts at Ecosoc to start the capitalization of WHO, Undp, and UNICEF multi-partner trust fund on NCD and mental health. This trust fund will help to leverage greater funding for the UN country team's efforts to support WHO's efforts domestically. Finally, I would like to congratulate our nominees for the Task Force Awards for your great contribution to shape the future for our children and 16th generation. Thank you very much.
Thank you very much indeed, Dr. Ren, for your intervention. Let's move on straight away to the Minister of International Development for Norway, His Excellency Dag Inge Ulstein. Welcome.
Thank you so much, Nick. And I'll try to be short, but I'm not surprised that everyone in here wants to spend all the time we can on this topic, because this is so important for all of us. So again, thank you to all my colleagues and all the participants that have given really good and strong messages so far. So excellencies, ladies and gentlemen, dear friends, and also to you, Dr. Tedros, if we are to get serious about global health and about eradicating extreme poverty by 2030, we also have to get serious about combating the world's main killer, and all of us know what that is, and that is non-communicable diseases. So the global NCD crisis has lasted for several decades and is disproportionately affecting low and middle income countries, causing millions of premature deaths every year. High death rates among individuals at their most productive age has enormous consequences, as all of us know. And these are diseases that are compounded by poverty, and they are compounding poverty at the same time. So it will not be possible to achieve the SDGs without a widespread effort to combat NCDs, including mental health disorders. Mortality due to mental health conditions is high, and the risk factors are much the same as for the other NCDs. We need multi-sectoral action to tackle air pollution, tobacco use, harmful use of alcohol, unhealthy diets, and physical inactivity. And we need to strengthen primary health care, since health systems in many low and middle income countries are poorly equipped to deal with the NCD pandemic. So we must provide assistance to low income countries in order to enable health facilities to offer adequate NCD services, including for prevention, early diagnosis, treatment, care, and management of complications. And not least, the SDGs call for integrated cross-sectoral actions and partnership, as we just heard from my colleague also. The World Health Organization is the directing and coordinating actor on health in the SDG era. And we would like to thank you, Dr. Tedros, for your leadership in this, also engaging and inspiring and pushing all the rest of us in this effort also. We also like to thank the Interagency Task Force on NCDs for coordinating a multi-sectoral response across the UN system to combat NCDs. And as many of you know, last year, Norway launched our NCD development program with a budget of $130 million last year. And we will work to enable WHO and other agencies also to collaborate efficiently with governments in low and middle income countries to reduce premature deaths from NCDs and to promote healthy lives. That was our purpose and our common goal through that work with the strategy and our program also. And we really hope that other donor countries and organizations will follow suit when it comes to this. Today, as all of us know, only a few percent of all global health-related development aid goes to NCD action. We need to change that, and we need to do that. In the midst of this pandemic, the COVID-19 situation, we need to bring this on the table and take action. Improving the health of the world's poor is not just a major goal in itself. It is also a major pathway to eradicating poverty. So thank you so much, and over to you again, Nick.
Thank you very much indeed. Let's move on to our next panelist, who is from Bahrain. It's Minister of Health Al Sayed. It's a pleasure to welcome you. My understanding is that you'll be speaking in Arabic, so therefore everybody needs to put on their interpretation. Thank you.
أصحاب المعالي والسعادة، السيدات والسادة المشاركين في هذا الحدث الجانبي، يسرني في البدء أن أتقدم بالشكر إلى الاتحاد الروسي ولمنظمة الصحة العالمية ولفريق العمل المشترك بين وكالات الأمم المتحدة المعني بالأمراض غير السارية لجعل مملكة البحرين شريكاً في هذا الحدث الجانبي الهام. وأود الإشارة في هذه الكلمة إلى أن حكومة مملكة البحرين قد التزمت التزاماً قوياً تجاه الوقاية من الأمراض غير السارية والصحة العقلية. فإضافة لوجود نظام صحي قوي قائم على استراتيجيات وخطط عمل ومؤشرات تم وضعها بالتعاون مع كافة الشركاء، فقد اهتمت المملكة كذلك بمواكبة كافة الجهود العالمية. ففي عام 2017 أثمرت زيارة فريق العمل المشترك بين وكالات الأمم المتحدة المعني بالأمراض غير السارية عن تنفيذ عدد من التوصيات ساهمت في الحصول مملكة البحرين على جائزة هذا الفريق في عام 2018. كما تم تنفيذ عدد من المبادرات والتدابير الوقائية لتعزيز أنماط الحياة الصحية بين السكان كممارسة النشاط البدني والتغذية الصحية وبرامج مكافحة التبغ والسرطان وتعزيز الصحة العقلية والمهنية. وفي نوفمبر 2019 وبالتعاون مع فريق الأمم المتحدة ومجلس الصحة الخليجي تم البدء في تنفيذ دراسة جدوى الاستثمار للوقاية من هذه الأمراض ومكافحتها، والتي اختتمت هذا العام بتحديد الخطوط العريضة للتدخلات الإكلينيكية والوقائية اللازمة. ولعل اختتام هذه الدراسة والعالم لا يزال يواجه جائحة كوفيد-19 وتداعياته على الأنظمة الصحية والاقتصادية وغيرها لهو دليل على أن القيادة الرشيدة لحكومة مملكة البحرين قد أحسنت الاستثمار في القطاع الصحي، وأن العائد من وراء ذلك كان استدامة تقديم كافة الخدمات الصحية الأساسية، ومنها خدمات الوقاية والرعاية لمرضى الأمراض غير السارية والصحة العقلية من خلال تعبئة الموارد اللازمة وتنفيذ عدد من المبادرات، كإعطائهم الأولوية في الحصول على مواعيد لإجراء اختبار تشخيص فيروس كورونا المستجد وفحوصات المتابعة الدورية، وتوفير وحدات متنقلة لتقديم الرعاية المنزلية، وتشغيل العيادات الافتراضية، وخدمة توصيل الأدوية للمنازل، وأولوية الحصول على اللقاحات. كما تم توفير حزم من الدعم المادي للمتضررين وبرامج للدعم النفسي والاجتماعي. السيدات والسادة، إننا نؤمن بأهمية دور الصندوق الائتماني المتعدد الشركاء والتابع للأمم المتحدة في إيجاد آليات تمويل مبتكرة لدعم وتمكين البلدان من أجل تسريع الاستجابات المتكاملة للأمراض غير السارية والصحة العقلية والنهوض بالنظم الصحية، لا سيما مع جائحة كوفيد-19 وما بعدها. وإننا ممتنون لتعاوننا المثمر مع فريق العمل من أجل الحد من الآثار الصحية والاقتصادية وغيرها من العواقب السلبية للأمراض غير السارية، ونؤكد على استمرارية تعاوننا وجهودنا معا حتى بلوغ أهداف التنمية المستدامة. شكرا لكم، مع تمنياتنا بالتوفيق والنجاح لهذا الحدث الجانبي.
Thank you very much indeed, Minister, for that intervention. We will now move on to two interventions from two of our important task force members. The first is the Deputy Director from the International Atomic Energy Agency, Najib Mokhtar. Welcome, please.
Thank you. Can you hear me? Thank you, Chair. Excellencies, ladies and gentlemen. We all have noticed the radical changes in our life caused by COVID-19 pandemic, but the disease put a heavier burden on the shoulders of the most vulnerable, whether it's people with underlying conditions or least developed countries. The vulnerable became more vulnerable. The International Atomic Energy Agency has been paying special attention to non-communicable diseases long before COVID-19. But allow me to highlight some key points in this vital issue since the pandemic began. The diagnosis and treatment of cancer patients requires access to imaging to ensure accurate management decisions and optimal outcomes. In high-income countries, imaging in modern cancer care is taken for granted, but the importance of imaging in oncology infrequently overlooked in efforts aimed at improving cancer care in low and medium income countries. Many low and medium income countries have severe shortages of imaging and nuclear medicine equipment and personnel. The agency is co-leading the Lancet Oncology Commission on medical imaging and nuclear medicine, using data from the IAEA database called Imaging. The Lancet Oncology Commission issued these opening messages. Globally, there is a major shortage of equipment and workforce, particularly in low and middle income countries. Scale-up of imaging would avoid 2.47 million of all cancer deaths between 2020 and 2030. This would cost about 6.84 billion in the lapse of 10 years between 2020 and 2030. This might sound a lot, but it would yield global lifetime productivity gain of 1.23 trillion. This would mean a net return of almost $180 per $1 invested. Scale up of imaging treatment and care quality would avert 9.55 million of all cancer deaths. Using a conservative human capital approach, scale up of imaging would provide a net benefit of 209 billion and net return of $31 per dollar invested. The good news is that these improvement or these improved health and economic outcome would be seen across all countries and geographical regions. But to reduce the burden of cancer globally and to make real change in low and medium income countries, we need actions and investment now. Actions and investment that would enhance access to imaging equipment, radiopharmaceuticals, workforce capacity, digital technology, and research training programs in low and middle income countries. For success, we also need political leadership, active participation from all major stakeholders, and alignment of country level and global effort to expand access to medical imaging and nuclear medicine. Now, the situation was already so dear in low and middle income countries, and then COVID-19 came. Worldwide, the pandemic had a dramatic impact on care of patients with cardiovascular diseases, for instance. According to an IAEA survey, COVID-19 resulted in a reduction in cardiac imaging in the world of 69% in March 2020, compared with the year before. To help ease the situation, we produced technical guidance for nuclear medicine departments to continue serving during COVID-19. Our webinars attracted over 2,400 health professionals from more than 110 member states. The UN Interagency Task Force, IATF, and related joint programs, such as the UN Joint Program for Cervical Cancer Prevention and Control, have been effective platform for joint UN work. We look forward to continuing our collaboration with many, if all of you, if not all of you. Thank you all.
Thank you very much indeed, Deputy Director General. These are all fabulous and powerful presentations that we're listening to, ones that we need to reflect on, both immediately after this, but also when we have our next task force meeting and as we develop our strategy for the next year. So thank you very much indeed. Adriana, Head of the Secretariat for the Convention Secretariat, are you with us?
Yes, I'm here.
Great, the floor is yours. Welcome.
Thank you very much. Honorable Ministers, Excellencies, and colleagues, I'm delighted to address you on behalf of the Secretariat of the WHO Framework Convention on Tobacco Control of WHO-FCTC. The Convention Secretariat has been an independent member of the UN Interagency Task Force on NCDs since its creation, and the implementation of the Convention has been one of the factors helping to drive down the risk of dying from a major NCDs to the current levels. And the WHO-FCTC has been globally recognized as an accelerator for sustainable development. But we have seen that tobacco users and NCD sufferers have been the worst affected by the COVID-19 pandemic. Still, amidst the pandemic, as the new 2021 UN Ecosoc Resolution highlights, countries need to strengthen their regulatory and legal frameworks to reduce the burdens of NCDs. And this includes the achievement of SDG Target 3.8 regarding comprehensive implementation of the WHO-FCTC to decrease the prevalence of tobacco use by 1/3 by 2030. And one of the main obstacles for that is the interference of the tobacco industry. Today, this industry is trying to portray itself as a development partner. Let's not fool ourselves. This is the same industry that makes a product that kills 8 million people a year worldwide. An industry that continues to produce, to market, and to sell their deadly products, while at the same time claiming that they are now concerned about public health, and actually they have the solution, rather than being, as they are, the cause of the problem. We have seen such maneuvers from the tobacco industry in the past. We, together with the whole UN family, must keep the tobacco industry from interfering in our own public health policies. And I urge UN member states that are parties to the WHO FCTC to fully implement the convention, including the measures to prevent such tobacco industry interference. Finally, I welcome the establishment of the new UN Multi-Partner Trust Fund to support countries to ramp up action on NCDs and mental health. And I remind countries that tobacco taxes, as well as taxes on other unhealthy commodities, can generate much needed revenue for building back better post-COVID-19. Let's keep working together to attain the goal of a healthy and sustainable world for all. Thank you very much.
Thank you very much indeed, Adriana. Let's move over to the Minister of Health for Uruguay, His Excellency Daniel Salinas. This again is going to be done in Spanish, so please use your interpretation facility.
Estimadas autoridades, es un honor saludarlos y desearles fructíferas jornadas en estos días. Hoy nos convoca la propuesta de trabajar conjuntamente el Fondo Fiduciario Tripartito de Enfermedades No Transmisibles y Salud Mental. Mucho nos complace anunciar que Uruguay está dispuesto a ser uno de los socios fundadores y a la vez estratégicos que permitan la implementación y el desarrollo del mismo. Sabemos que los desafíos planteados por la pandemia del COVID-19 nos convoca a pensar en temas inmediatos, posteriores, pero no menos prioritarios. Las enfermedades no transmisibles representan el 70% de las muertes en el mundo. Y las enfermedades cardiocirculatorias, el cáncer, las enfermedades respiratorias y la diabetes, el 80% de las muertes prematuras por enfermedades no transmisibles. Durante las 2 últimas décadas, Uruguay ha priorizado la lucha contra las enfermedades no transmisibles. Ha sido destacado el combate al tabaquismo, la especial atención a la alimentación saludable, en particular con la regulación del etiquetado de alimentos, la promoción del ejercicio y la prevención del uso nocivo del alcohol, así como el abordaje de las enfermedades mentales, las que han sido trabajadas en la legislación nacional. Uruguay ha integrado la Alta Comisión Independiente de la Organización Mundial de la Salud sobre enfermedades no transmisibles, una de cuyas recomendaciones precisamente fue la creación de un fondo fiduciario de múltiples donantes para el abordaje multisectorial de los países a las enfermedades no transmisibles y la salud mental. Esta es una gran oportunidad para los habitantes de la región de las Américas de obtener recíprocos beneficios de nuestras experiencias nacionales compartidas. Invitamos, por tanto, a la comunidad internacional, a los estados asociados a las fundaciones y al sector privado a unir esfuerzos en esta importante iniciativa. Muchas gracias.
Thank you very much indeed, Minister of Health, for your intervention. We've got two last panelists. Most of you are familiar with the fact that the Economic and Social Council provide the task force with a resolution each year. One of the things they highlight is the importance of the UN system when it comes to mental health and NCDs, working with civil society and with the private sector. That's been a recurrent theme over many years. So it's a pleasure now to welcome Katie Dane, who's the Chief Executive Officer at the NCD Alliance, to speak.
Thank you very much for the opportunity to speak today. And I'd like to start by really acknowledging the work of the UN Interagency Task Force and the launch of the new multi-partner trust fund on NCDs and mental health. The NCD Alliance has long been a supporter and a champion of this multi-partner trust fund, as we really believe it's been one of the missing pieces of the global NCD response for many years. And I'd like to specifically acknowledge the leadership and vision of WHO, of UNICEF, and of Undp in getting the trust fund together, and to Uruguay, as we've just heard, as one of the founding strategic partners. I'll focus my short 3 minutes on three key messages on NCDs, COVID and financing, all of which are very relevant for the launch of this trust fund. And they have all been drawn from our new NCD Alliance publication entitled A Global NCD Agenda for COVID Resilience and Recovery. First and foremost, COVID-19 must really be a wake-up call for governments and political leaders to value, to prioritize and to invest in health and NCDs. We simply won't be prepared for the next pandemic or any other health threat unless governments really get a grip on their burdens of NCDs, the causes and their upstream determinants. Over the last decades, we've seen a really woeful and shameful underinvestment in this issue that affects 22% of our global population. And there's been really a flat line at best of ODA for NCDs, hovering below 2% of $22 billion of official development assistance for NCDs. Sweeping changes, including legislation, were made in a matter of weeks to protect the public from COVID. We really need to see the same urgency in responding and financing the NCD challenge. So we really call upon the international community and governments to step up, recognizing that for all governments, particularly in low middle income countries, domestic resource mobilization is now much, much harder with the impact of COVID. And so catalytic investment via ODA will be critical, and the trust fund really comes in here. We've now got the mechanism in place to raise the funds, a means to channel catalytic funding to low middle income countries and to scale up real country-led plans and priorities. And I think it's fair to say that its success, however, will only depend on the engagement and funding contributions from many of you in this virtual room, governments from all income settings. Otherwise, it will really remain an empty shell, as other trust funds have, and a real missed opportunity. Secondly, what we've seen over the last 18 months is that the deadly collision of NCDs and COVID really reinforces the need for an integrated response and the need to break down silos. NCDs and COVID, as we've heard from other speakers, are two sides of the same coin, and these two agendas really need to be brought together. And we need to see this integration in many fronts, in terms of national action plans and responses, in terms particularly of getting NCDs strongly integrated into COVID and pandemic preparedness plans. At the global level, I think there's really an unmissable opportunity right now to increase value for money spent on the global COVID response for all health issues, including NCDs, really a COVID plus response, if you will. And one example of that is integrating screening for hypertension in COVID vaccine rolls out and leveraging supply and cold chains for other essential medicines such as insulin as low-hanging fruit. And then thirdly, my third message is really to build upon Chantel's at the beginning, which is to invest and to engage in communities. I think this pandemic has really highlighted once again the imperative to be community-led. And this call should be taken up everywhere as a global public good, not only to prevent and contain infection, but also to support communities to raise awareness and to support the post-COVID recovery agenda. And within this, our goal should be about making lived experience the engine of the movement, and push for meaningful involvement of people living with NCDs in every step of the response, whether we're talking about governance and decision-making bodies, in shaping policy and essential services, as well as monitoring and accountability. Just a couple of weeks ago, the NCD Alliance was very proud to launch the first global charter on meaningful involvement of people living with NCDs, which is the result of extensive consultation with a range of stakeholders and recognizes people living with NCDs as indispensable partners in the response. The charter really outlines the foundations, the fundamental principles and strategies needed to make meaningful involvement a reality. And we're looking to multilateral agencies, governments, organizations across the board to endorse and sign on to the charter as really a statement of commitment and intent to improve. So we hope that for those of you hosting, speaking at this event and attending this event, that you'll consider this invitation and champion this important cause. Thank you again for the opportunity to speak.
Thanks very much, Katie, for your intervention. So I highlighted the importance of both civil society and the private sector. And so it's a pleasure to conclude our panel discussion with the Executive Vice Chairperson of CIPLA, Samina Hamid. Welcome.
Thank you. It is an honor to be given the floor at such a high-level panel, especially as the sole representative of the private sector. I represent the third generation of the founding family at CIPLA. We at CIPLA are very proud to have been associated with the I Quit initiative towards tobacco cessation. CIPLA has donated nicotine replacement therapy to WHO for India, and we are ready to continue that cooperation with the UN Interagency Task Force to reduce the burden of the disease generated by the addiction. Nicotine replacement plays a very important role in helping tobacco addicts to quit smoking, fight the craving, and manage withdrawal symptoms. Our company is the largest manufacturer of nicotine gums, lozenges, and patches in India. We partner with government services, health professionals, and civil society organizations to promote tobacco cessation. We consider that the UN Interagency Task Force on NCD is a strong convener and a natural interlocutor for private companies concerned with public health, such as CIPLA. Striving to reach the Sustainable Development Goals is central to the mission of CIPLA. It governs our policies as a company, both in our internal operations and our interaction with our patients. CIPLA pioneered generic medicines for the treatment of HIV infection, which has contributed to the affordability of HIV care and has triggered the push towards universal access to treatment. Today, this has become a reality for more than 27 million patients globally. Controlling and fighting non-communicable diseases is an important focus for us, where CIPLA is a world leader. The members of this panel who have taken the floor before me have spoken eloquently about how task forces can bring about accelerated and measurable results in the coming years. It is important to remember that such achievements will require the mobilization and partnership of private sector partners who care about global issues, in particular from the pharmaceutical industry. You will always find CIPLA ready to contribute to reaching objectives of the task force and to cooperate with the United Nations, especially the World Health Organization. Thank you for your kind attention.
Thank you very much indeed, Samina. And that brings us to the conclusion of this panel. Thank you very much for everybody for your interventions, for all the thought and preparation that's gone into those, and for everyone listening who I'm sure will have benefited greatly from what we've heard. Let's now move back to Svetlana to take us to the third and final phase of this session. Just one last thing, I've heard that we can keep the translation going for another 15 minutes, so please stay tuned. Svetlana, back to you.
Thank you. Thank you very much, Nick, and thank you for this very interesting and interactive discussion. As I said at the beginning of the meeting, we are getting your questions in the chat, and we will be happy to provide you an answers on this. But now we are moving to the most exciting and enjoyable part of this event, the award ceremony. And it's a great pleasure for me that today we have the Deputy Director General, who will do this enjoyable work for the WHO, for the award of the UN Interagency Task Force. So Dr. Susanna Jakob, Deputy Director General, the floor is yours.
Thank you very much, Svetlana. Thank you very much, Nick. Dear colleagues, this is the 4th year that the Task Force Awards have been run. We thank all those that submitted nominations. Winners were selected on the basis of demonstrative commitment to multi-sectoral action in preventing and controlling NCD-related SDGs at local, national, regional, and international level, with particular weight given to nominations that demonstrated evidence of one or more of the following: new and innovative activities, acting as exemplar for others, overcoming significant obstacles, demonstrating outstanding leadership, and mobilizing resources, knowledge, or expertise. This year, nominations were specifically encouraged for organizations working with children and youth groups, as well as those working with minority communities. Nominations were also encouraged that highlighted action maintaining focus on NCD-related SDGs as part of the COVID-19 responses. Self-nominations are not allowed. This year we have 19 winners. Awards are being made in 3 categories. First, Ministries of Health or government agency under a Ministry of Health. Second, ministries or government agencies beyond health. Third, non-state actors, that is non-governmental organizations, academic institutions, and philanthropy. Let me first read out the first group, the winners in the category of Ministries of Health or government agencies under the Ministry of Health. The Ministry of Health and Medical Education in Iran for demonstrating excellence in delivering mental health services during the COVID-19 pandemic. Second, the Health Service Executive, Republic of Ireland, in recognition of developing structured illness and preventive care in general practice to reduce morbidity and mortality from NCDs that has been developed over the last 6 years and rolled out during the pandemic. The Ministry of Health and Medical Services, Republic of Nauru, driving forward action to reduce NCD risk factors and strengthening the management of NCDs and mental health conditions during the COVID-19 pandemic. The Department of Health, Ministry of Public Health, Thailand, for its outstanding contribution to reduce sugar consumption in Thailand by leading a multi-sectoral action to tax sugar sweetened beverages and setting an example on future pro-health taxes. Public Health England for their exemplary work in introducing and sharing experience in working with industry to reformulate food and drink with lower levels of salt, sugar, and calories. The Gulf Health Council for championing multi-sectoral action to the prevention and control of NCDs across 6 Gulf countries, that is Bahrain, Kuwait, Oman, Qatar, the Kingdom of Saudi Arabia, and the United Arab Emirates. Now let us move to the winners in the category of ministries or government agencies beyond health. The National Assembly of Armenia for enacting a landmark tobacco control law, which will protect Armenian population from tobacco-related harm. The Parliament of Georgia, in recognition of their outstanding efforts to strengthen national tobacco control legislation and reduce the heavy burden of tobacco attributable NCDs in Georgia. The Ministry of Finance and Planning, Cabo Verde, in recognition of their efforts in strengthening tobacco tax policy, which contribute to multi-sectoral action on prevention and control of NCDs. The Food Safety and Standards Authority of India, for the India at 75 Freedom from Trans Fat by 2022 initiative, collaborating with food industry associations. The Food and Drug Authority, Kingdom of Saudi Arabia, for their role in preventing NCDs and promoting public health by improving the nutritional value of food, including through the multi-sectoral healthy food strategy. Zambia National Broadcasting Corporation, for raising awareness on NCDs among the general population, including during COVID-19 pandemic. Finally, the winners in the category of non-state actors, non-governmental organizations, academic institutions, and philanthropy. The Kamili organization in Kenya, for their achievements in providing community mental health services and commitment to battling the stigma associated with mental health. Dasman Diabetes Institute in Kuwait, for their work with the Ministry of Health to develop a national diabetes register and their contribution to the prevention and treatment of diabetes and its complications. Makna Mylis Cancer National Cancer Council in Malaysia, for their outstanding work to support cancer patients and survivors. The Sudanese Childhood Diabetes Association, for the exceptional work to support children with diabetes and their families. Movendi International Sweden, in recognition of their advocacy work to protect people from harmful use of alcohol. City Cancer Challenge Foundation Switzerland, for driving concrete action to strengthen and multiply quality health services, workforce, and infrastructure, thus advancing access to NCDs and cancer treatment at city, regional, and national levels. Project Hope USA, for engaging vulnerable youth through community-based health programming, social and mass media campaigns, and advocacy with national and local leaders in the health and education sectors, including their virtual program focused on prevention of NCDs. Congratulations to all those awarded today. We look forward to hearing progress on your work in the months ahead, and that these awards encourage even greater action, both by those awarded and others in responding to the challenge of the NCD-related SDGs. Thank you very much, and back to you, Svetlana.
Thank you, DDG. Congratulations to all winners. It's really a big challenge on this time to have this really very big achievement, and we are very happy that we have this award this year, as it is the traditionally second year our virtual format. These awards will be delivered to the winners, and also the certificates and the letters from DG, and we will do it very, very soon. So we are at the final stage of our meeting today, and let me thank everybody for this interesting discussion, interventions that we had. And let me ask the co-chair, the Russian Federation, Honorable Minister of Health of the Russian Federation, Mikhail Albertovich Murashko, to take the floor and to say final remarks of our meeting today. Over to the Russia, to Moscow.
Глубоко уважаемые коллеги, министр здравоохранения, к сожалению, вынужден был срочно выехать в правительство, но поручил сказать несколько заключительных слов мне от его имени. Глубоко уважаемые коллеги, подошло к концу наше сегодняшнее мероприятие. И нам хотелось бы поблагодарить лично генерального директора Всемирной организации здравоохранения доктора Тедроса Адханома Гебрейезуса, коллег из Всемирной организации здравоохранения, лично Светлану Аксельрод, секретариат межучрежденческой целевой группы ООН по неинфекционным заболеваниям, министров здравоохранения и делегации стран, агентства ООН и негосударственные учреждения за интересную и плодотворную дискуссию. В ходе заседания мы увидели результаты объединения усилий в борьбе с неинфекционными заболеваниями. Мы обсудили разработку и принятие более эффективных национальных норм и стратегий в странах, и, что самое главное, увидели рост осознания важности эффективного контроля за неинфекционными заболеваниями не только среди лиц, принимающих решения в сфере здравоохранения, но и среди широкой общественности. Только совместными усилиями при координирующей роли Всемирной организации здравоохранения мы сможем достичь поставленной цели в области устойчивого развития к 2030 году, уменьшив на треть преждевременную смертность от неинфекционных заболеваний посредством профилактики и лечения, поддержания психического здоровья и благополучия. Желаю всем дальнейших успехов, крепкого здоровья и надеемся увидеть всех вас на следующей встрече группы друзей целевой группы ООН по неинфекционным заболеваниям. Спасибо.
Thank you very much, Dr. Salagay, the Deputy Minister of the Russian Federation, for providing these remarks, closing remarks. And we are really very sorry, but we have to say the final words because our meeting is coming to the end. So let me first of all to say the thanks to the colleagues in the WHO who joined us today, the Director General, the Deputy Director General, also my colleagues in headquarters. And of course, I highly appreciate the participation of honorable ministers and distinguished guests who were today on the panel. We again apologize about the technical problems that we had at the beginning, but we just checked that this was the bug in the Zoom, so it's not the problem of our technical team. It seems that we were very interested and somebody tried to join us. So, dear excellencies and honorable ministers and distinguished guests, I am really excited of the number of participants from all over the world that was today with us, and we really had a very rich and productive discussion. And thanks to those who spoken today and provided their leadership on NCDs and mental health issues. We are really very excited by the speech of our testimony about the life experience, how it is to live with the mental health and NCDs condition. And we will continue working closely with all non-state actors and especially with the civil society on the area of NCDs and the mental health. During these days, during the pandemic of COVID-19, it is very important that we remember the declaration that was taken 10 years ago during the UN General Assembly. That was the first political declaration on NCDs in 2011, when we've got the NCD and mental health agenda to the top of the discussion. And now we have this agenda in the discussion of the all UN agencies related to the health. One of the also major message that we have, it is the 2021 Ecosoc Resolution. And it is the call upon members of the task force to work together to support a robust and coherent response to member states, to NCDs as a part of their national COVID response and recovery plans. We must use the pandemic as an opportunity to catalyze in actions to prevent and treat NCDs and mental health conditions. And it is critical to fully resource this important global initiative that we have today. And the multi-partners trust fund on NCDs and mental health this is the mechanism that we can use. This fund will demonstrate the ways in which whole of society and solutions can give and drive effectiveness in and increase domestic funds and improve policies and legislations. Also, the regulation and promote mental health. And that is very important that we have these partners in the UN agencies, UNDP and UNICEF, who are also the partners of the UN Trust Fund. We hope that the funds will come soon and we will have more UN agencies on board. And finally, what I would like to highlight at the end of this meeting, the three major messages. And the first is that addressing NCDs and mental health must be the integral part of the immediate COVID response and recovery at global, regional, and national and subnational levels, building back to achieve Agenda 2030. The second, actions outside the health sector is critical for effective responses to COVID-19, NCDs, and mental health. And this requires decisive leadership across many sectors. And the third that is very important to highlight at the end of our meeting, that the government, policymakers and UN agencies and development partnership must work together to support countries to develop their strong responses on NCDs and mental health. So that is the key points that we have after this meeting. And I hope that we will continue these interesting meetings in the future, hopefully in our previous format in New York as we did it previously. So thank you very much, everybody, and for the interpretations today. Thank you very much. And be healthy. See you next time. Bye.